Clostridium difficile, commonly called C Diff, is a bacterial infection that causes inflammation of the colon or colitis and diarrhea, which can be severe and even deadly. This is the number one cause of hospital-acquired infections, and it is an organism that is evolving and changing and becoming a bigger problem. In its evolution, it has evolved and has now jumped out of the hospital into the community. The number of cases has risen dramatically to almost 500,000. The number of deaths has risen dramatically to almost 30,000. And so not only is this becoming a common infection that causes diarrhea in the community, it's becoming harder to treat and more aggressive. This is an organism that forms a spore, which is like a protective shell, so it can resist antibiotics therapy. The way C. diff infects the colon is traditionally antibiotics are used for any reason, such as a sinus infection or a dental procedure, and the normal healthy bacteria that live in our stool are destroyed by the antibiotic, which gives this organism an opportunity to take over the colon, so to say. We can treat the C. diff with several antibiotics which are effective, but the organism's spores will then open, so the colon becomes reinfected and there's a relapse of infection. So a novel therapy over the last 10 years has been the implementation of Fecal Microbiota Transplant, which is a fancy name for what some people are hearing about now, stool transplant, which is taking stool from a healthy person and placing this in the colon of a C. diff patient, achieving very high rates of cure with these therapies.